Hi friends, good evening. Once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam preparation. Also these questions will helpful for your other nursing officer exam preparation. In the previous video we discussed previous year questions and answers till question number 41, and here we can see the next question. Who is the father of psychoanalysis? And options: option A William James, option B William Wundt, option C Ivan Pavlov, option D Sigmund Freud. And the correct answer is option D Sigmund Freud. First option William James. William James is a psychologist, also he is a philosopher. And the second option William Wundt. William Wundt is a founder of experimental psychology. Also, he was the first psychologist to measure human behavior. And also, in 1879, William Wundt established the first psychology laboratory in Germany. So, he is the founder of experimental psychology. Also, he is a psychologist to measure the human behavior. And also, he established the first psychology laboratory in Germany. These all contributions by William Wundt. See, Ivan Pavlov, one of the theories of learning, that is learning by classical conditioning, put forward by Ivan Pavlov, learning by classical conditioning. Here our question answer, father of psychoanalysis, is by Sigmund Freud. Option D is the correct answer. Next question. The organelles concerned with the metabolic process are present inside the options. Option A ribosome, option B cytoplasm, option C endoplasmic reticulum, option D mitochondria. Question. The organelles concerned with metabolic process are present inside the cytoplasm. Option B is the correct answer. Next question. Which method is used to separate butter from cream? And the options: option A centrifugation, option B amalgamation, option C titration, option D filtration. Which method is used to separate butter from cream? And the correct answer is option A centrifugation. Move on to the next question. Epigraphy is the study of options: option A inscriptions, option B geography, option C physics, option D science. Epigraphy is the study of inscriptions. Option A is the correct answer. The fight or flight response is characterized by the following except options. Option A increase in BP, option B increase in oxygen intake, option C mental alertness, option D decrease in cardiac output. Question. The flight or fight response. Flight or fight response means when we are in stressful situation or if we are in fearful situation. So what are the characteristics features occurs in the body? Okay, except is the question. So among this, which one is not occurs during the time of fight or flight situation? Increase in BP can occur. Surely it will occur in case of fearful or stressful situation, and increase in oxygen demand, mental alertness. But decrease in cardiac output will not occur in fight or flight response. So that is the correct answer, option D. Question. The type of autopsy that is done to determine the cause of death for medico-legal purposes. Options. Option A clinical, option B diagnosis, option C research, option D forensic. A question. Which type of autopsy is done to determine the cause of death for medico-legal purpose? Autopsy means is to examine the body part after the death of a person. Okay, it is mainly to rule out the cause of death. It is correct answer will come forensic. Which type of autopsy is done to determine the cause of death for medico-legal purpose is forensic type. What percentage does the bones of genitalia constitute by the rule of 9? Options. Option A 18%, option B 9%, option C 1%, option D 21%. Percentage of burns in genitalia by rule of 9 is 1%. Option C is the correct answer. Atropine sulfate is administered before electroconvulsive therapy. Options. Option A, as a short-acting anesthetic. Option B, to reduce secretions. Option C, to alleviate anxiety. Option D, to relax muscles. Why we are giving atropine sulfate before ECT? It is mainly to reduce secretions. Option B is the correct answer. Question. Psychotherapeutic use of movement is called. Options. Option A, relaxation therapy. Option B, music therapy. Option C, dance therapy. Option D, recreational therapy. Use of movement is called dance therapy. Option C is the correct answer. The legal definition of death that facilitate organ donation pertains to the cessation of options. Option A, pulse. Option B, circulatory and respiratory functions. Option C, respiration. Option D, functions of the brain and its entirety. So after death, the legally after death, when we can do organ donation, okay, it is mainly to the cessation of functions of the brain and its entirety. Option D is the correct answer. Question. The most common hospital acquired infection is. Options. Option A, bladder. Option B, digestive system. Option C, respiratory system. Option D, kidney. The most common hospital acquired infection is a respiratory infection. Option C is the correct answer. Next question. The systemic evaluation of behavior, emotion and cognitive function of an individual is known as. Options. Option A, process recording. Option B, mental status examination. Option C, history collection. Option D, neurological examination. The systemic evaluation of behavior, emotion, cognitive function of an individual is known as mental status examination. Option B is the correct answer. Question. How are ECG changes presented in ischemia and myocardial infarction? Options. As a small Q wave with an elevation in the ST segment and a peak or inversion in the T wave. And option B, as a depressed ST segment. Option C, as an elevated PQRS. Option D, as a larger Q wave and P wave. Question. ECG changes in ischemia and MI, myocardial infarction. So what is the ECG changes we can see in case of myocardial infarction and ischemia? Changes in MI is either ST segment elevation and T wave inversion, or non-ST segment elevation we can see in case of myocardial infarction, and also abnormal Q wave may be also present in case of MI. Okay, and hours to days after MI, this ST and T wave changes will return to normal. ST segment elevation or T wave inversion or non-ST elevation will return to normal, but Q wave changes usually remain permanent. It will not come in normal stage in case of MI. Option A, as a small Q wave with an elevation in ST segment and a peak or inversion in the T wave. Option A is the correct answer. Which of the following analgesic drug lacks anti-inflammatory action? Options. Option A, diclofenac sodium. Option B, paroxicam. Option C, paracetamol. Option D, ibuprofen. Drugs with lacks anti-inflammatory action is paracetamol. Option C is the correct answer. Remaining all are having anti-inflammatory action. Next question. Which one of the following is the scope of nursing research? Options. Option A, to develop the knowledge. Option B, to develop the answers. Option C, to develop the assessment. Option D, to develop the concept. And the correct answer is option A, to develop the knowledge is one of the scope of nursing research. Which cells are that take part in innate immunity by killing virus infected cells? Options. Option A, macrophages. Option B, NK cells. Option C, neutrophils. Option D, T cells. Question. Which cells are mainly take part in innate immunity by killing virus infected cells? It is by NK cells or natural killer cells is a type of white blood cells which takes part in innate immunity by killing the virus infected cells. Question. Which is the most important drug in the treatment of organophosphate poisoning? Options: option A atropine sulfate, option B adrenaline, option C N-acetylcysteine, option D diazepam. Question: which one is the most important drug used for the treatment of organophosphate poisoning? And the correct answer is option A atropine sulfate. And the next question: each person creating his or her universe through his or her perception is referred as. Options: option A problem solving, option B reasoning, option C creative thinking, option D critical thinking. Once again the question: each person creating his or her own universe through own perception is known as creative thinking. Option C is the correct answer. We discussed till question number 60 and remaining 30 questions are there that we can see in the next video. If it is useful for your studies, please share my videos to your friend circle. Surely these questions will boost your knowledge.